Hello and welcome to the loose tooth infection video. What is a loose tooth infection? What are the symptoms and causes? How do I prevent it? If you've ever had one, you may be able to find a good treatment option. In this video, we'll cover some common causes and how to prevent it. But before we move on to the specific treatment, let's look at how to recognize a loose tooth infection. In the meantime, don't be afraid to take ibuprofen if you feel some pain. Treatment options. There are several treatment options for loose teeth, including a splint. Deep cleaning can keep your loose tooth in place, and the hygienist can tighten the gums around it. In some cases, regenerative therapies may be needed to rebuild lost bone and support your tooth. A dental implant or fixed prosthesis is another option. If your loose tooth is the result of periodontal disease, treatment may involve a bone graft or extraction. An over-the-counter pain reliever may help relieve the pain of an infection, such as ibuprofen, Advil, acetaminophen, Tylenol, and naproxen. Antibiotics are sometimes prescribed by a dentist for severe cases, which may spread the infection throughout the body. The first-line antibiotics are amoxicillin and penicillin, which are safe for most dental infections. An abscess is usually drained surgically. This procedure is usually done by a dentist or a maxillofacial surgeon. This dentist specializes in jaw conditions and is trained to perform surgical procedures. The procedure may involve drilling a hole through the gum and extracting the abscessed tooth. If left untreated, an abscess is likely to return and require additional treatment. If you suspect you have an infection, consult a dentist right away. If you suspect you have a dental abscess, it is important to visit a dentist as soon as possible. However, some patients may need to visit a hospital emergency department to be stabilized. There, a medical doctor will administer antibiotics to reduce pain and stabilize the patient. However, it is important to seek medical treatment as soon as possible. These treatment options are available for most loose tooth infections. So, the first step in treating a loose tooth infection is to get it checked out by a dentist. If you notice a loose tooth, your dentist can help you determine what the root cause is. If your loose tooth is the result of periodontal disease, a root debridement may be needed to reduce the infection and create a more solid foundation for your tooth. If it is caused by tooth decay or an abscess, a root debridement will help you to prevent further loose teeth and regrow them in the future. Symptoms. If you're experiencing any of the symptoms listed above, you may be experiencing a tooth infection. While you're likely feeling some discomfort, it's important to see a dentist immediately. While it's tempting to ignore symptoms, this can lead to serious problems if left untreated. In many cases, the infection will not go away on its own, and you'll need to seek medical help for any complications. Luckily, there are several options for treating a loose tooth infection. Sepsis is a potentially life-threatening condition if left untreated. Sepsis is a type of infection in which the body's immune system reacts inappropriately. It damages the bloodstream, causing organ failure and even death. Treatment for sepsis typically involves intravenous antibiotics and fluids. In severe cases, it may even require surgery. Severe cases may require the assistance of a neurologist. The infection itself can spread throughout the jawbone, causing inflammation. In some cases, it may even affect nearby teeth. In such cases, a tooth infection can cause bone death around the tooth, and the swelling may spread to adjacent teeth. Abscessed teeth can affect the maxillary sinus, which often holds upper molar roots. Because of this, infection may spread to the brain through the veins surrounding the tooth. Ultimately, this can lead to a serious infection, which may require a root canal. Aside from pain, the infection can also cause swelling in the face. While this is an unpleasant symptom, it is important to seek medical attention immediately if you are experiencing any of these symptoms. It is important to visit a dentist as soon as possible if your child has one. Severe cases may require hospitalization. A tooth infection can even be life-threatening if it affects the airway. Therefore, it's essential to get it treated as soon as possible. Apart from swelling, abscessed teeth can spread to the face and neck. The bacteria that cause this type of infection can enter the tooth and form an abscess. It can even spread to the body tissues around the tooth, such as the bone. A dental abscess develops when an infection in the tooth spreads to the gums or jawbone. It's critical to seek medical care right away, especially if you suspect it has spread to other parts of your body. Causes. If you are experiencing loose teeth, you may have a bacterial infection in your mouth. This type of infection affects the gums, soft tissues, and bone that support your teeth. Left untreated, this disease can lead to gum recession and eventual tooth loss. Signs of gum disease include bleeding gums during brushing and flossing, as well as sensitive gums and bad breath. You may also be clenching or grinding your teeth. If this is the case, you should see your dentist to get the infection checked. If you suspect that your loose tooth is caused by a bacterial infection, see a dentist as soon as possible. In severe cases, the infection could lead to an abscess, which can cause a high fever and difficulty breathing. If you notice a painful infection, you should see a dentist right away. You may be required to pay a visit fee, which will depend on the severity of the infection. Several factors can increase your risk of developing a tooth infection, including smoking. Bacteria thrive in a dry mouth, so proper oral hygiene is essential to prevent tooth decay. Additionally, some medications and diseases can lower your immune system. Ultimately, if left untreated, a tooth infection can spread to the jawbone, soft tissues around your tooth, and even the heart and brain. Ultimately, the only way to treat this situation is to visit a dentist. An abscess is an accumulation of pus in a body tissue. Some abscesses begin inside the pulp, but some extend into adjacent bone and gum tissue. It is important to note that there are different types of abscesses. A dental abscess can be a bacterial infection or a periodontal abscess. Ultimately, you should see a dentist as soon as possible if you notice any of these symptoms. Other potential causes of loose teeth include medication. Certain anti-resorptive medications can affect the teeth's ability to absorb calcium. Some of these drugs also increase the risk of tooth decay by drying out the mouth. As a result, these medications should not be stopped abruptly without consulting your dentist. Your oral health is very important, so don't neglect it. If you suspect you have a loose tooth infection, contact your dentist right away. Prevention. Periodontal disease is a painful condition in which the gums, bone, and tissues surrounding the tooth become inflamed. Bacteria on teeth and plaque in the mouth form a film that is difficult to remove. When this buildup gets deep in the teeth, it can become infected. To prevent loose teeth from developing, brush your teeth twice a day and floss once a day. If you have periodontal disease, you may need to use oral antibiotics to fight the infection. A dentist can drain the pus from an infected tooth. You can also rinse with salt water to alleviate pain and discomfort. It is important to seek medical treatment as soon as you notice any swelling. A visit to the dentist is recommended at least twice a year to avoid a serious infection. Remember, just because you feel better does not mean the infection has cleared up. If you continue to experience tooth pain or sensitivity, you should visit a dentist immediately. While loose teeth can cause discomfort and pain, they are usually not a cause for alarm. Fortunately, proper dental care can prevent infection from getting worse. You should brush your teeth at least twice a day with a soft brush, floss daily, and use an antiseptic mouth rinse. You should also eat lots of calcium-rich foods and avoid soft drinks, as even sugar-free sodas contain acid. When you notice a loose tooth, make an appointment with a dentist as soon as possible. You should also avoid food that contains sugar and starch, which are common sources of bacteria in the mouth. Consuming more dairy products and leafy vegetables, lean meat, fish, eggs, and other calcium-rich foods will help prevent cavities and loose teeth. Brush your teeth twice a day with fluoride toothpaste and floss daily. Avoid sugary drinks and junk foods, which contain additional sugar and starch. To prevent tooth detachment, brushing and flossing should be done daily. Avoid clenching or grinding your teeth, as this will increase the amount of bacteria in the mouth, causing tooth detachment and pain. Another common cause of loose teeth is periodontal disease, which is a bacterial infection of the bone and gum tissue surrounding the teeth. Poor oral hygiene can lead to the formation of tartar in the space beneath the gums. This bacteria can eventually destroy the bones that support the teeth, making them loose. Once you have this disease, you should see a dentist to prevent further damage and a loose tooth infection. The sooner you get this condition treated, the better. Thanks for watching. Please like, comment, and subscribe.